And the third role play, we're going to have the same doctor. I guess the earlier version of Dr. Chang. And we're also going to have a...
Version 1.
Version 1, Dr. Chang 1.0. And then we have a patient from Russia.
Hello, I'm Dr. Chang.
Hello, Dr. Chang. Ola Kabulova. Nice to meet you.
What's your name?
Ola.
Oh, okay. Oh, Olga, can you sit down? Okay. And so what brought you here? And, are you having some symptoms you want to discuss?
Yes. Well, first of all, I want to thank you very much for seeing me, Dr. Chang. This has been a big, big problem. And it's been going on for very long. But in the last 6 months or so, it's been totally unbearable. You know, I have to go to the bathroom all the time. And have many, many bowel movements to the point that it's interfering with my work. I'm a piano player and I teach. I used to go to people's houses and teach their kids and stuff, and now I can only do it in my house because I need to have a bathroom. So I need some help. And you know, I want to ask you, actually, in Russia, we have this medicine that is very, very good for stopping diarrhea. It's Margantovka. I hope you can prescribe that, because just a few drops, you know, it's purple. I remember it from childhood. You just put a few drops and diarrhea stops for the day. It's amazing.
Yeah, you know, from looking at this, we don't have it here in the United States, so I'm not going to be able to give this to you.
That's a shame.
I'm sorry, but we have other medicines I could give you, but I'm not going to be able to get you this one.
That's too bad. You know, it's excellent medicine, but yeah.
Yeah, well, there might be something else here that we could discuss. Can you tell me a little bit more about any other symptoms you're having?
You know, I don't know what to think anymore.
It got worse in like 6 months, and in what way?
Yeah, so it's just, I don't remember it that bad. I used to have it for years, you know, diarrhea and a little pain, but now I can't eat. Every time I eat, I have to run to the bathroom. It's embarrassing. I mean, there's pain and I can go 7 times in a day. I can sometimes wake up at night to go to the bathroom. And
now, have you been experiencing any weight loss?
I lost about 8 kilograms, but you know, that's okay. I don't mind that. That's all right.
But did you want to lose weight, or were you just losing weight and not really trying?
I couldn't eat, and I traveled to Russia, and I thought the food is not agreeing with me, so I don't know, but that's not a big deal. Sometimes I have a little kind of bleeding.
And when do you get that?
Well, I think I don't know the word in English, but it's hemorrhoidae, you know, at the bottom.
What was that again?
Hemorrhoidae. I'm not sure how to say it in English.
you mean hemorrhoids, where you can get some bleeding?
I think so. I think that's the word, but you know, that's been happening before, so I'm not too concerned. I just need something to really get this under control.
Yeah, well, there's a lot of different conditions that can cause your symptoms, so usually we do some types of tests that we can order to just make sure.
I had a lot of tests in Russia already, so you know. I mean, I had blood tests and things, and I was told there's nothing too bad, but I don't know I don't know if it's the same thing now or different.
Yeah, I'm not sure that you had, it's good to do some tests, make sure you don't have an infection. Also look for a condition called celiac disease that can cause these symptoms. And often, in particular, since you're having some weight loss, which is new, we can look in your colon. We do a procedure, a test called colonoscopy, where it examines your...
Is that really necessary?
Well, because you're having these symptoms and they've gotten worse, and you're actually having some weight loss.
You know, I want to think about that. I don't think.
Well, maybe I could just explain it to you first. Is that okay?
Okay.
Okay. So it's a procedure where you look inside the lower bowel and you look for inflammation or tumors, and it's not likely that you have it, but it's something that we should just check to make sure that we can make the proper diagnosis.
What do you think I have, Dr. Chang?
Well, I think it's important to do a physical exam, get some tests, and then we can determine. You might have a condition called, especially since you've had it so long, although it is worse for the last 6 months, is something called irritable bowel syndrome or IBS.
I don't think so.
Okay.
See, my sister has that diagnosed, and she has very different. I don't know. I mean, I just don't think so. But yeah.
And why don't you think so?
Because she has problems when she's stressed, and I don't have problems at that time, and it's very different.
Oh, okay.
But I just want you to understand what's happening to me. I'm losing my pupils, my students, in the houses where I go. I was at the recital when we finished with the piano playing, and all the parents are there and everything. You know what I mean? And I was sitting in this beautiful dress on a stool at the piano, and I was feeling how I'm getting a stain on my dress from the bowel movement, and I couldn't get up. I need something, Dr. Chang. I really do need something to stop this. I'm 36 years old. I can't have that.
Well, I understand. It sounds like it's gotten worse. So I think what we should do is we'll do the physical examination. We can talk about any tests that you might need, and then we should talk about some treatments, because I can see that this is it's gotten much worse.
Thank you. Thank you very much.
She was going to make me cry.
What did we notice in this interaction? What were some things that was unique to this case based on the fact that she was a patient from Russia? Good. So the name of the medicine, which is Margan Sophie, right? So there is a belief, as we're understanding, as we're learning more about the Russian culture, that Russian medicines are very good and very strong. And a lot of information comes that they're superior in some way, and that's something to be aware of. What else?
It's a very formal. And she expected that she would give her the American version of this medicine. And she ignored it totally. She didn't think it's a very effective drug. She threw it away.
Very dismissive. Handed it back to her, and instantly the rapport took a hit as a result.
Yes, and it's a very bad start. So from that moment, she didn't accept any idea of the doctor. She has she knows what she wants. She wants this drug. That's all she wants.
And sorry?
She doesn't want to make any studies, nor thank you. No, she has no problems. I mean, she's very shut. Really,
she's very closed off. And did you mention that she has resistance to tests?
Yeah,
did you mention that?
She said so.
Great. So that might be one thing we notice is coming out of like a Russian culture is that this belief in the Russian culture that in America they do too many tests and that they're not necessary. And if we're heighten our awareness in advance of that, that might help and inform.
And the doctor is not open to negotiation with the patient also.
Great. And that goes back to that's not even dealing with cultural issues. That's a simple doctor-patient thing, where the doctor has one agenda, we know, but the patient has another. And instead of having those work at cross purposes, how can we have those two agendas work together, right? And how can we create the conditions for that?
Yeah. I have a few questions. Firstly is, do we need to let patients to fill some forms to elevate their feeling condition? I mean, the emotion condition. For example, SF 36, the form, to elevate the emotion, the patient's emotion.
So Dr. Wewe is talking about whether they should have some screening psychologic forms before they come to see the doctor.
I'm not crazy.
Take it anyway.
The second question is, in my idea, this afternoon I learned from you is, I think maybe it's the dialogue therapy. Just talking to treat the patients. So I think if it's a dialogue therapy, I think listening and talking is very important. Listen more clearly and, for example, and asking patients. For example, asking patients does diarrhea related with your diet, related with your emotion, related the time. For example, early morning or after meal. I think it's very important with cold or some.
The context of the symptom. in their life.
Right. So we have two things. One is connecting his point to his earlier point about the importance of psychosocial issues and the kind of curiosity. Was there some sort of questionnaire around what's going on in their life? And also placing the symptom in context. Placing the symptom in context. What's going on in their life that could very much inform. And again, this doctor was a bit closed off to that. Right. And explaining that concept to the patient, which could then help them understand and would probably increase compliance. Good. We have one in back, and then we have two people here. Please.
Of all the three scenarios, I think this is the one that's least biased by cultural values.
Mm-hmm.
The only thing that came out to me was the medication she had received in Russia, but we have patients like that who get things they had 10 years ago that work that aren't on the market. I think this underscores just a difficult patient that you have a hard time getting rapport with, but the failing is not so much the cultural aspect, is the psychosocial aspect of what you said, the negotiating, cajoling them, not saying no to that because it cuts off the conversation and nobody's happy out of the two individuals.
Right. And I very much acknowledge what you say. I don't know if it was entirely apparent in this role play, but that could tie into culture in the sense of communication style. So one thing about that we've kind of learned in our research about communication style, specifically Russians, is that Russians, in their effort to communicate and communicate well and effectively, they can kind of get on a train and they can interrupt, and they can seem to be argumentative when they're not trying to be argumentative, right? They might interrupt and they go, no, but, and it's not that they're arguing your point. It's just that they want to add information to that, which can make an interaction very, very challenging. So it's kind of I think it might be a both-and situation. So hang on one second, and we'll come to you.
She was trying she was talking about the colonoscopy. And of course it was very important. She said that she lose weight, she has blood in her stool, incontinence, but it was not in the patient point of view. Mm-hmm. She was not talking, I don't know the word.
On the same level.
Eye to eye, yes, the same level.
eye.
She was trying to convince her, but...
Right. Again, the agendas, we're working at cross purposes, and how can we merge those? I want to pass it over here.
No, it's okay. I wanted to say that not only Russians say yes, no.
Not only Russians, right? You know that right. And please, we're not trying to stereotype. We're not trying to caricature. We're trying to point out some features of some cultures, but ultimately we want to recognize some of the isms of all cultures, or some of the isms, the tendencies across cultures. So there are a lot of cultures that are kind of very animated and expressive, and interruption might be more of a cultural norm than, again, a source of argument and contention.